Let me know when to start.
Good afternoon, everyone. I'm Dr. Hita Patel from IIP Digital Media team. I'll be hosting for the today's webinar, which is on exercise prescription for PCOD, evidence-based physiotherapy approaches, with the resource person, Dr. Anupama, being organized by IPWC. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IP profile on social media platforms. Facebook's, Instagram, Twitter, LinkedIn, and YouTube. Follow IAP profiles on this social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notification of our live webinars in playlist section of this channel. Webinars are segregated into various folders on this topic like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, and many more for each axis. The social media link will be shared in chat shortly. Over to Charu ma'am.
Yeah, thank you. Welcome all to this to this webinar today by Dr. Anupama Karkara. Dr. Anupama Karkara is an associate professor at Father Muller College of Physiotherapy, Mangalore, with extensive experience in teaching, clinical practice, and community-based rehabilitation. She holds a bachelor's and master's degree in physiotherapy from Father Muller's Medical College under Rajiv Gandhi University of Health Sciences and has also completed certification in sensory integration from the University of Southern California. Her professional interests focus on pediatric neurorehabilitation, women's health, and community physiotherapy. She is actively involved in mentoring postgraduate students, guiding research, and providing clinical training in pediatric rehabilitation. Dr. Karkara is a life member of the Indian Association of Physiotherapists and the Indian Academy of Cerebral Palsy and is also associated with International Society on Early Intervention. She is actively involved in academic research with several publications currently in progress. Her ongoing research primarily focuses on pediatric neurorehab, PCOD, physical fitness in children, sensory integration, and innovative rehabilitation approaches such as telerehabilitation for children with special needs. So, with that introduction, I hand over to Dr. Anupama to start her talk for the day. Over to you.
Thank you, ma'am. Good evening, everyone. On the special occasion of this World International Women's Day, I would like to begin with a quote. A woman's true strength lie in her health. So most of our health has been compromised because of the busy lifestyle, following which we are not entertaining ourselves into the usual physical activities, fast grab uh, foods like fast foods like burgers, pizzas, etc., which is I think every one of us like, isn't it? So following which we have a big growing pandemic, which is very silent, that is hampering the health of the growing woman and the young woman. And globally, nearly 8 to 13% of women have noted to have PCOD, out of which again 70% are seems to be undiagnosed because most of them they don't want to come out and say that they have PCOD or they have some irregular periods, etc. So quite often it is undiagnosed, and following which it has become a growing challenge all over the globe to have a reproductive age go through this kind of disorder. So we'll dive into the PCOD, exercise prescription for PCOD and evidence-based approach. So I'll be sharing my screen. I hope it is visible. The screen is visible?
Yes, it is.
Okay. So today's topic for discussion is exercise prescription for PCOD, evidence-based approach. So we all know that most of the times children these days are having PCOD, as well as young adults come up with PCOD. How many of you have come across adolescent kids having PCOD? I'm sure quite a lot of you must have come across. My interest on this PCOD started when one of my friend's daughter was diagnosed with PCOD, and mother came to me with the concern that she just started with the menstruation, and now she's diagnosed with the PCOD, irregular periods, heavy, literal unbearable pain, etc. So following which, it made me more interested to read about it, and we did one small little bit of study, also cross-sectional study, to know the inflammatory response of people who are having PCOD. So from then, a little bit of more interest I had developed on this topic. So what is this PCOD as such? So PCOD, or your polycystic ovarian syndrome, is nothing but it's a endocrine condition in women of reproductive age, manifesting with lifelong reproductive, cardiometabolic, psychological, dermatologic symptoms, leading to lifelong issues. Okay, fine. So when it comes to the reproductive issues, it is seen as infertility, oligomenorrhea, as well as androgenism. When it comes to the cardiometabolic symptoms, it is impaired glucose tolerance, insulin resistance, type 2 diabetes mellitus, cardiovascular disease risk. And most of the time, it is observed that PCOS young females have a lot of issues with anxiety, depression, disordered eating, and low self-esteem, as well as body image distress. This is a very common problem where a little bit of stress, we end up having overeating, isn't it? So this is one of the main symptom for psychological symptom that is associated with the PCOS. With that, there is also this dermatological symptoms like acne, facial hirsutism, androgenic alopecia. So all these contribute to reduced quality of life, and also quality of body image also reduces. What are the main causes or the etiological factors? There are two main categories, that is non-modifiable factors as well as modifiable factors. When it comes to non-modifiable factors, it is basically the ethnicity and the family history. Do you know which ethnic race has more affinity towards PCOS? It is the South Asian population has more ethnicity, more affinity towards PCOS, mainly because of they are genetically made have the history of they are genetically have affinity towards higher fat storage, as well as they are more prone for type 2 diabetes mellitus. So this again goes with the thrifty gene hypothesis, following which the South Asian population are more known to have store the fat mass comparing to the other races. Then family history of type 2 diabetes mellitus gifted by our ancestors. Coming to the modifiable factors, which we can definitely modify, the suboptimal lifestyle behaviors, which includes the prolonged sedentary behaviors like sitting at work, lack of regular physical activities, optimal intake of food groups. Like most of the times, the fast food what we usually eat doesn't has fiber, protein, or micronutrients. So this suboptimal intake is one of the main factors. and the overconsumption of energy dense highly processed foods like the sugar sweetened beverages. Most of us, we end up having high, juices, sprites, and this all these things could be a main factors which could be which we can easily modify. And this doesn't start where at the age of adolescence. If you're going to see most of our growing children from the infant or the toddlers, we happily feed them and good amount of chocolates, sprite, juices, etc. This is what is making them grow into the child who has to suffer with PCOD. I think we have to first work on how the food styles and the activities. Now most of the children we can see in and around where they don't know how to play. They are all with the digital gadgets. All these factors, digital gadgets, good amount of suboptimal foods, then overconsumption of energy dense foods like all uh, colas, etc. From the childhood we have been feeding them. Birthdays we give them good amount of cakes and chocolates which are not really good. So following which they end up growing into the adolescents who have either insulin resistance or obesity leading to PCOD, etc. So this is something what we have to make them grow with the healthy eating lifestyle, healthy active lifestyle. So that is one of the very much modifiable factors which has to start not from the adolescent but also from the toddlers. Now, coming to the other causes obviously the overweight or the obesity and the degree of insulin resistance and androgen excess increases. All these things contribute to exacerbation of the PCOS symptoms. What are the different types of PCOD? Now, different types of PCODs are basically insulin resistant PCOD, post-pill PCOD, inflammatory PCOD, adrenaline PCOD. Now, when it comes to the insulin resistance PCOD, this means the body cells don't respond properly to the insulin, the hormones that helps move sugar from the blood into the cells. As a result, the body produces more insulin to compensate. Okay, so they are not able to understand the insulin is produced. So pancreas keeps producing more and more to compensate because it's not able to recognize. Okay, so prevalence in PCOS is 75% of the lean women with PCOS have insulin resistance. 95% of women with PCOS who are overweight also are having insulin resistance. Okay, so what happens next with the extra insulin that has been stimulated by pancreas leads to hyperinsulinemia. Okay, and this stimulates the ovaries to make more androgen. That is nothing but the testosterone, the male hormones. And it also reduces the sex hormone binding globulin, that is SHBG, a protein that normally keeps the hormone levels balanced. Together, this leads to hyperandrogenism, too much of androgen. So following which they might have a lot of hairs, etc. So which causes symptoms like acne, excess hair growth, and irregular periods. What is the health risk beyond the hormones? With the insulin resistance, this is linked to fatty liver disease. Now, type 2 diabetes mellitus also includes for this with the increased incidence of heart disease, even in women who aren't overweight. Medical guidelines, mainly what we have is because of these risks, doctors recommend regular checks for obesity or weight checks, blood sugar control, glucose tolerance tests, cholesterol and lipid levels, blood pressure, or hypertension. Now, insulin resistance is a core problem in PCOS, driving hormonal imbalances and increasing risk of serious health conditions. Also, it is contributing factor for the chronic inflammatory process, which is a silent poison that is continuously there in our body. Exercises and diet and regular medical screening are so important in managing the PCOS. Next, How are they usually managed? By low glycemic diet, regular exercises, sometimes even medications like metformin, especially if they're having the type 2 diabetes mellitus. Coming to the post-pill PCOD, this usually happens after stopping the birth control pills. That is why it is called post-pill PCOD. So this is basically the hormonal imbalance when the body adjusts after stopping oral contraceptives. So once the oral contraceptives are stopped, the body has to adjust, and there is an hormonal imbalance, following which they might have the missed periods, delayed periods, acne, temporary ovarian cyst. There are quite a lot of the time when they have taken this one contraceptive pills, and following which they have ovarian cyst because of that. So for often temporary, and the cycles may normalize within months after they have stopped the oral contraceptives. Then inflammatory PCODs are mainly triggered by chronic inflammation in the body. PCOD by itself will lead for chronic inflammations, and the main possible causes are poor diet, stress, environmental toxins, and gut issues. Now, coming to the signs here, they have a persistent fatigue, skin problems, headaches, irregular periods. Management is usually anti-inflammatory diet and the lifestyle. Adrenal PCOD, this is basically caused by the excess androgen production from the adrenaline glands rather than the ovaries. So common signs here, what we get to see is high stress levels, hair thinning, acne, elevated hormones in blood tests. Then treatment often includes stress management and hormonal balancing. Important symptoms of PCOD at this particular condition is irregular absent period, acne, excess facial hair, difficulty losing weight, fertility issues. So all some of the symptoms which are very common, that is your irregular periods, then acne, excessive hair. Okay, but in adrenaline you will see that they have difficulty in losing fat as well. So the cycle of androgen excess and ovarian dysfunction in PCOS, this basically there is when there is an insulin resistance, there is high luteinizing hormone leading to excessive androgen, that is testosterone and androgen hormone. This will lead to ovarian dysfunction with the polycystic ovaries, thickened ovarian tissues, irregular ovulation, and leading to the symptoms of hirsutism, acne, hair thinning. And this will be again causing the imbalances or the disrupted cycles, menstrual cycles, and leading to infertility also. Now, diagnostic criteria is basically depending on the Rotterdam diagnostic criteria. Even the WHO also says Rotterdam criteria is the one for the diagnostic diagnosis of PCOD. This is nothing but it is diagnosis by the presence of at least signs and symptoms of high androgen excess, that is excess facial or body hairs, loss of testosterone, irregular ovulation, and
Dr. Anupama, uh, please unmute yourself. You are still on mute, huh? Dr. Anupama?
No, initially, no, till now, no one heard, is it? Hello?
The
No, we
last,
heard
Hello?
only last 2-3 minutes. We could not hear.
Is it? Okay, I didn't,
Yeah.
I didn't mute it. I don't know. Okay. May I know till which slide it was not audible? Hello?
Just the
Hello?
last slide, ma'am. Just 2 minutes. Enough. Last slide you can
This one?
repeat.
From this slide, ma'am.
Yeah, the previous one, yes.
Yeah.
Oh, okay.
You can
Okay,
continue.
yeah, thank you. Yes. So the common symptoms, what we come across, I think we have already discussed about this in the initial of the definition, but I would like to repeat it again. That is the symptoms when it comes to the reproductive symptoms are hyperandrogenism, oligomenorrhea, infertility, and polycystic ovaries. When it comes to the cardiometabolic symptoms, it is obesity, insulin resistance, hepatic steatosis, hyperglycemia, then hyperinsulinemia, dyslipidemia, inflammation, androgenic alopecia, that is hair loss, hirsutism, that is excessive hair. When it comes to the psychological and well-being symptoms, it is basically the anxiety, depression, disordered eating, low self-esteem, body image distress, reduced quality of life. These are some of the very common symptoms what we get to see in PCOD, and following which the quality of life of a growing woman, a growing child, adolescent child, as well as a young adults, it is compromised. So now, next, coming to the PCOS and mental health impact, how PCOS can cause mental health issues. The moment there is a weight gain, the body image is impaired, or they would feel bad about their body image. Plus, there could be infertility and hair loss. Okay, leading to again disordered eating. Again, it is a vicious cycle. So, following which there are higher risk of depression and anxiety. This is a key challenge leading to mood disorders, body image distress, eating disorders, leading to all possible things what we have already discussed. Okay. This reduces the quality of life, leading to strained relationships, infertility struggles, and low energy and motivation. Evidence in role of exercise in management of PCOS. Physical activity is defined as any bodily movement generated by the skeletal muscles, which results in energy expenditure. Example for physical activity include active commuting and gardening, or maybe doing the household core work, etc. Now, exercise is a physical activity that is planned, structured, and repetitive, which is often undertaken to improve or maintain health, well-being, and performance. So these are the two key things what we have to incorporate in the PCOD patients, mainly because of the usual sedentary lifestyle is more dominating than our core jobs. How exercise helps in insulin resistance. Muscle activation improves sugar use. Now, when we exercise, our muscles pull in more glucose from the blood. This happens because protein called GLUT4 moves to the surface of the muscle and acts like a door for the glucose to enter. Now, GLUT4 is normally activated by insulin, but exercise activates it too, even without insulin. Now, AMPK boosts insulin sensitivity. So, exercise triggers an enzyme called AMPK, especially with the higher intensity or longer workouts. AMPK helps muscles absorb glucose, and improve how cells respond to insulin after exercise. PCOS muscles respond to exercise. After workout, women with PCOS show better insulin signaling in their muscles, similar to healthy women. This means their body temporarily becomes more sensitive to insulin. So, following which exercise promotes better uh, better exercise response and more insulin sensitive. It effects are very temporary. So the benefits of exercise on insulin sensitivity fades within 72 hours. So that is why regular exercise is essential for long-term improvement, and it has to be like across lifespan. And we can't think that for a short period of time we got good results, then we stop. It just comes back like how our fat mass comes back. So mixed results in studies are, some studies show exercise improves insulin resistance, but others show less clear results. So this may depend on type of exercise, aerobic versus strength, intensity and duration, timing of follow-up tests, individual differences, that is age, weight, PCOS type, etc. Now, aerobic versus strength, it is mainly for the obese people. We'll focus more on the weight reduction and endurance with the resistance training. But when it comes to the lean PCOD patients, we will mainly focus on the resistance training and not on losing weight. So the aerobic exercises would be moderate and not at the high intensity level. So the key takeaways are basically the exercise helps muscle absorb sugar better and improve insulin sensitivity even without weight loss. But to keep these benefits consistently, consistency is a key. So the type, intensity, frequency of exercise all matters. So whatever, whether to lose weight, whether to manage the hormones, the consistency is key for everything. So because the exercise effect is only up till the 72 hours. How exercise affects androgen access and ovarian function in PCOS. Effect on androgen levels. Exercise can increase sex hormone binding globulin. This protein binds testosterone, reducing the amount of free androgen in the blood. High insulin levels normally suppresses sex hormone binding globulin, leading to free testosterone. Exercise lowers insulin, which may indirectly help balance this androgen level. However, studies show mixed results. Some improvements in insulin were seen, but androgen levels didn't always change significantly. So these results are basically taken from some of the one of the recommended guidelines from Australia. Mechanism involved are basically insulin and insulin-like growth hormones stimulate the ovaries to produce more androgens. By lowering insulin, exercise may reduce this stimulation, but the exact pathways are still unclear. So the effect may depend on exercise type, intensity, and duration, as well as individual differences, depending on their mindset as well. Effect on ovarian function. How exercise can promote better ovarian function. Exercise improves menstrual regularity and ovulation rates. Benefits are linked to better body composition, more lean muscles, and less fat. Reduced hormonal imbalances. A 4-month according to the guidelines, a 4-month program of aerobic and resistance training improved menstrual cycles and reduced upper body fat, even though hormone levels didn't change much. Some evidences suggest exercise may also normalize ovarian structure morphology by affecting ovarian nerve activity independent of body composition changes. Key takeaways are exercise can raise uh, SHBG, lowering free androgen levels. It reduces insulin levels, which indirectly helps with androgen balance. And evidence is mixed with the androgen levels don't always improve the ovarian function, but regular exercise improves menstrual cycles as well as ovulation and body composition. So this is a whole of a cycle. If again, here also consistency is a key. If they're consistent enough with the exercises, then we can get this good result. How exercise affects cardiometabolic health, weight, and body composition in PCOS. Cardiometabolic health, when you're talking about it, we have to talk about the weight circumference. So exercise consistently reduces waist size, which reflects low visceral fat. So fat around internal organs. So the more the visceral fat or the more increase in the waist size, it suggests that the visceral fat is more higher. So exercise can reduce this visceral fat. Also, it improves better lipid profiles. So some study shows that there is improvement, but again, this results vary. Fasting insulin often improves with the exercise. Fasting blood glucose usually stays normal, so changes are less noticeable. Why glucose may not change much. In PCOS, the body often produces extra insulin to keep blood sugar normal. As insulin resistance improves, insulin levels drop, but glucose may remain stable. 1 minute. So exercise variables that matter are aerobic. Now, the type of exercises are aerobic versus strength training, intensity moderate versus high, duration and frequency. Longer or more regular sessions show better results. Muscle strengthening, often missing in studies but important for full benefits. There are some studies suggesting that muscle strengthening has a positive impact on the reduction of inflammatory process as well as the better result for the hormonal balance. Weight loss versus body composition. Weight loss helps, but exercise improves health even without major weight loss. So you may not see a drastic weight loss and good shape, but it can definitely reduce the inflammatory markers, following which the health might be more better. So this includes benefit like less central fat, better muscle to fat ratio, and the moment the inflammatory markers reduces, the risk for the low cardiovascular disease is going to be reduced. Coming to the mitochondrial function and fitness, women with PCOS often have weaker mitochondria, energy producers in the cells. So exercise improves mitochondrial function and insulin sensitivity. So the cardiorespiratory fitness is a good marker for the better mitochondrial function. Just a small improvement, that is 1 MET, reduces all cause of mortality by 13%. Also, it improves the cardiovascular fitness by reducing the risk of heart disease by 15%. Takeaways: exercise improves waist size, insulin levels, fitness, and fat distribution. So you can see here before exercise and after exercise. Before exercise, there was increased visceral fat, but after exercise, the waist circumference is reduced, and insulin. Uh, when it comes to the insulin and blood sugar, although the insulin level might be looking high, but the blood sugar comes to the normal. Okay, so unhealthy lipid levels at the before the exercise can show that there is improved or normal lipid profile after the exercise, and more body fat before exercise after exercise, you can see that the muscle mass, more lean muscle mass and less abdominal fat. Before the exercise, lower fitness levels, and after the exercise, you can see that better heart and lung health, leading to better cardiovascular fitness. So the fitness gains protect against heart disease and improve metabolic health and reduce the heart heart attack or the heart condition and improve metabolic health. Mental benefits. Exercise helps in reducing the depression and anxiety symptoms without major weight loss. There might be no much of weight loss at the initial stages of exercise, but still they might have lesser depression and anxiety. Women with PCOS who are more physically active report fewer mental health issues than the inactive individuals. There are a lot of studies where they have compared the inactive and active PCODs, and they have found that there is the whoever is active lifestyle, they have less depression and anxiety. Exercise improves body image and reduces body dissatisfaction, which and again leading to depression. So quality of life improvements also is seen. It also enhances the emotional well-being, fertility outlook. They will be having more better hope for the conservation, as well as weight perception is going to be more better. Recommendations for implementing exercise intervention in PCOS. Now, after seeing all the benefits, we'll just go into the recommendations. We have what are the main goals of exercise in PCOS? Mainly to improve the metabolic health like insulin sensitivity and cholesterol, reduce the central fat, belly fat, to so that we'll reduce the visceral fat as well, support mental well-being and body image, enhance cardiorespiratory fitness, muscle strength, as well as encourage healthy lifestyle habits and not just weight loss. And it has to key consistency is a key, and another very important goal is to have more better consistent program for the patient across their lifespan. So PCOS care is multidisciplinary. Doctors, dietitian, physiopsychologist, physiotherapist, and medication is key for all professional things. Mainly, the patients are already depressed with fertility as well as the health issues. So the communication has to be in such a manner that they'll be able to understand the benefits of exercise. So diet, exercise, behavioral strategy are the first line therapy for PCOS other than the medications. Exercise is recommended for all the women with PCOS regardless of weight, whether it is obese or lean. Weight loss is helpful, but not only the goal. The goal will be only for the obese patient, not for the lean patients. Exercise benefits health even without the major changes in the weight. Supervised exercise programs are more effective because they will be having more better motivation following the supervision. But in cases where the supervision is not possible, there are unsupervised exercise regime also has supported the health benefits. Medication related to the PCOS considerations in PCOS exercises. Most of the time, insulin resistance and weight management drugs are like metformin and GLP-1 receptor agonists. These are the medications what they usually be given to the patients. So during the exercise, we have to make sure that we'll be monitoring the blood sugar level to check the hypoglycemia, as well as the blood pressure has to be checked pre and post, to check their hypertension during and after the sessions. We need to adjust the exercise according to the patient's requirement. So the treatment has to be focused and individual specific, especially if they have symptoms like dizziness, fatigue, sweating, etc. When it comes to the cholesterol lowering drugs, especially when they have high lipid profiles, statins kind of drugs are given. So following which exercise implication if the muscle soreness may be amplified when combined with exercises. Okay, we need to give them certain kind of strategies like warm baths or maybe cold compressions, etc. Watch for unusual muscle pain beyond the normal post-exercise soreness. If there is more than the exercise soreness, it could be because of the drug side effects as well. Refer for the medication review if the symptom persists. Mental health medications like antidepressants and antipsychotics are associated with weight gain by themselves. So, following which that might trigger more weight gain and the symptoms. So, exercise implication has to be tailored depending on the medication related weight gain. Focus will be on more progressive aerobic exercise plus resistance to support the metabolic health. Here, the progression should be based mainly on the aerobic exercises and resistance exercise, not only the physical activities. Consistency is again the important key here for both mental health and physical outcomes, especially if they are on the medications. So following the exercise, what are the benefits what we get? This picture is taken from one of the article which I'll be sharing with the main panelists. So maybe whoever wants can take from them. It's I have got some beautiful articles, but one of them had this beautiful picture which shows all the benefits of the exercises. So the exercises helps in reducing luteinizing hormone, then FSH. It reduces testosterone and increases SHBG. It increases insulin sensitivity, reduces blood sugar risk of diabetes. It decreases total cholesterol level and decreases cardiovascular risk as well. And here you can also see that there is a decrease in the decrease in inflammatory markers, oxidative stress markers like interleukins as well as the CRP levels and ROS. When it comes to the anthropometric, this is mainly for the body image, where you can see that there is a good amount of calorie burn as well as reduction in the fat, weight loss. Waist circumference can be the main thing about the body image. So there is reduction in the waist loss. Hip circumference might be also reduced with the increased lean mass. Mental outcome, it will usually the exercises are known to release the endorphins and lead into reduction in the stress, anxiety, depression, and body image distress. Reproductive, ultimately, it regulates the menstrual cycle by increasing ovarian reserve ovulation. So these are the whole benefits of the exercise PCOS. So lifestyle and exercise strategies, exercise and diet combined have best results. Aerobic and resistance training both are important. And dietary approach, balanced and low calorie diet has to be monitor hypoglycemia. Then health benefits like weight loss, improved reproductive health, mental well-being, psychological supports. All these are the lifestyle strategies we have to include in the PCOS. Now, when it comes to the mainly the prescription, mainly we have to a basic goal is 150 to 300 minutes of this one. What workout has to be given per week, or at least 75 to 150 minimum vigorous aerobic exercises has to be done per week. Extra benefit is around 250 minutes or 150 minutes vigorous aerobic exercises per week. Okay, so this what will happen with all these vigorous exercises. It will help in insulin sensitivity, reducing belly fat as well as boost fitness. Now, cardio at least 30 minutes per day. So 5 days per week. Minutes given. And again, it should be individual specific and patient condition specific and culture specific. So it has to be tailored individual specific program and cannot be generalized for as a whole protocol for everyone, because each culture and health condition, because there could be a lean PCODs, there could be obese PCODs, there could be a person who is having insulin resistance, there could be a person having insulin sensitivity. So each and every PCOD patient is individually different. So exercise has to be tailored accordingly, including the aerobic activities like could be the swimming, the walking, etc., etc. Conclusion: exercise is a cornerstone therapy in PCOS management, improving insulin sensitivity, reducing central obesity, increasing cardiorespiratory fitness, and supporting as a lifelong lifestyle intervention, not ovary syndrome, to achieve better health, confidence, and well-being. These are my references. Main references was basically from the Exercise in Management Polycystic Ovarian Syndrome, a positive statement from Exercise and Sports Science Australia. This is also beautiful 2023 International Evidence-Based Guideline, and of course WHA fact sheets, where the beautiful articles which I'll be sharing with the panelists was online available. And I would also a copilot which help me do the infographics is with the insulin resistance, etc. So these are some of my main references. Thank you. So any questions?
Yeah, thank you, Dr. Anupama, for your wonderful
Thank you.
talk on PCOD. You gave a wonderful overview about what it is, what are the associated factors, and what exercises have to be given. So I see one. I'll open it up to any questions. I can see one hand. Anybody can raise their hand if they want to ask any questions. Chaitanya has raised her hand. Is there anything you want to ask? Okay. Dr. Anupama, I have a question for you.
Yes,
Yeah.
ma'am.
Do these I understand that it has to be a combination of exercises like strengthening exercises and aerobic exercises. So is there like any modifications we have to make if it's an adult or if it's an adolescent? Any specific care has to be taken? Yeah, there's a question from somebody who says how to go about strengthening in teenagers. So that's what I also wanted to know, whether is there any difference between how you prescribe exercises for adolescents or for adults?
So adolescents usually we can go with the almost a strength training, but it has to be at the moderate intensity, not at the higher intensity, because they are at the growing phase. So the high resistance might be hampering their uh, uh, growth, especially the epiphyseal plates, etc. So high intensity of resistance training not be recommended. I would suggest more of the low and moderate intensity resistance training for them. But with that, I would also emphasize on the high interval training, where it might have more benefit for the adolescents as well as the young adults, which we have certain RT which says that they have got more better benefits high intensity interval training with the work rest if the patient requires, or the rest in between. So that is what my understanding is. Yeah, so somebody wants to add on for this, I would be enriched with the knowledge.
No, that's fair enough.
So,
Yeah. There's another question from another one of the participants. Is there any particular aerobic exercise that have shown to have a higher benefit compared to the others for PCOS?
As if now I have not come across particular aerobic exercises as such. They are giving a group of exercises, including the brisk walking and the resistance training, like that. But I have not come across, or maybe I have not searched for such an article. Maybe I have not come across specific aerobic exercise. Most of the time, they have talking about the brisk walking and more of calisthenic kind of exercises and resistance training, like maybe Pilates and core strengthening, like that. Not come across the specific aerobic exercises.
Yeah, I think it has to be a structured program which includes both aerobic as well as
Yes.
strength training exercises. Yeah.
Yes, ma'am.
Is there anybody else who has a question?
I would like to thank all the panelists of IAP, as well as Charu ma'am, Priya ma'am, Roshna ma'am, as well as Roylin, who is my student, for considering me for a talk. I hope I have done the justice for whatever the topic we have selected for this commemoration of International Women's Day. So thank you very much.
Thank you, ma'am.
Roshna, do you want to conclude?
Yes, ma'am.
Yeah. If there are no more questions from the panelists also.
Just one question, ma'am.
Yeah.
Yes,
Is
ma'am.
weight loss necessary, ma'am, for all the PCOD patients? Like both are there, right? Nowadays.
Not really, ma'am.
Yeah.
Yes, not really. Weight loss is only necessary for obese patients and not for the lean patients. That is why when it comes to the obese patient, we recommend more of we balance out the resistance training as well as the aerobic exercises, depending on how is their overweight. So if they are having extremely overweight, then maybe we'll be going on more of upper zone exercises than having high impact on the knees. Whereas when it comes to the leans, we will be recommending them more of high resistance training, so that they will have more better lean mass, muscle mass, and not lose the weight. So for them, maybe the light to moderate aerobic exercises we would recommend. Whereas when it comes to the aerobic exercise of the obese, maybe we'll go a little bit more for the as the goal is even the weight loss. So the goal for the lean PCOD patient is never a weight loss, but to increase the hormonal regulation. Whereas here we have to focus even on the weight loss as well as the hormonal regulation.
Okay.
So that is a thing. So
Yeah.
mainly focusing on resistance training in lean PCODs.
Yeah. Okay, ma'am. Thank you.
Thank you.
Okay. Any more questions? Or can I wind up with the session?
I think we can wind up now.
Yes, ma'am. Okay. So, on behalf of everyone, I would like to express my heartfelt thanks to all those who made this event a wonderful one. First and foremost, I extend my heartfelt gratitude to our IAP President, Dr. Sanjeev Jha, IAPWC National Head, Dr. Ruchi Vashni, and IAPWC South Zonal Head, Dr. Prabha Vinod, without whom this event would not have taken place. Next, I thank Dr. Sumita Himawati, IAPWC Karnataka State Head, for her constant support and motivation. I also thank all members of Karnataka IAPWC State Team, Dr. Kalai Sevi, Dr. Dhanalakshmi, Dr. Shanti Karthik, and Dr. Priya S. I extend my sincere gratitude to Dr. Priya S., Sub-Coordinator, Karnataka State, for guiding us throughout. My sincere thanks to our moderator and Mangalore District Head, Dr. Charu Ipan, Bangalore District Coordinator, Dr. Beena Ma'am, and our panelists, Dr. Roylin Pinto and myself, being the sub-coordinators of Mangalore District, for their valuable contribution. I would also like to thank our digital team members, Dr. Utra and Dr. Heta, for their support and cooperation throughout the session. I express my heartfelt gratitude to our speaker, Dr. Anupama Karkera, for their insightful and inspiring speech. Your valuable thoughts and perspectives have truly enriched our understanding, and we are grateful for the time you spent with us today. I thank all our dear participants for their enthusiastic involvement. Finally, I thank each and everyone present here for your valuable time and presence. Your encouragement means a lot to us. Once again, thank you all for making this event a memorable one.